good afternoon. So I'm Ivy. I'm the nurse practitioner student that's going to be talking with you today. How are you doing, Mr. Fawcett? Good. I'm glad to hear you're doing well. I just wanted to go over some stroke education with you just to make you more aware of some stroke symptoms and different things that you can do to prevent it, and then what to do if you or someone you know is having a stroke. Just you can recognize it and get them the help they need, or yourself. So, would you like to go over that with me? Great. I want to go ahead and give you this handout. This is a handout I made upside down on stroke recognition, and then an action plan, both for an action plan for if you or someone you know is experiencing a stroke, or things that can be done to prevent a stroke. So I'll go ahead and hand you that. Great. Yeah, it is kind of fun, isn't it? So my stroke recognition action plan, I went together and found some information on the CDC, the Stroke Awareness Foundation, some different places, along with some research articles, just to provide the best education and information to you. So stroke is the number one leading cause of death and disability in the world, and it's the fifth leading cause of death and disability in the United States, which actually has decreased. It was the fourth, and just recently it's decreased to the fifth leading cause in the United States because of the health promotion and awareness, stroke awareness, and prevention that healthcare providers across the country are providing. So that's wonderful, and that's why we're continuing to do it, because what's been put in place is helping with the incidence of stroke. So let's get started. Probably have heard the FAST mnemonic used before. It's on billboards, it's in hospitals and doctors' offices, and even I've seen some on campus at Cedarville University. So the mnemonic stands for FAST, is FAST, F-A-S-T. F stands for facial droop. So if one side of the face is drooping, it's hard to mimic that, but if one side of the face is drooping when someone's talking or when they try and smile, that can be a sign of a stroke. Another is arm weakness, and it's usually on the same side as that facial drooping, one-sided arm weakness. Can't hold their arm up, can't grasp something, so that would be a sign of a stroke. And then speech difficulty, so if someone is slurring their words, they can't think of the words they're trying to say, or just even understanding words that are being said to them, that is also a symptom of a stroke. And then the T in the mnemonic FAST stands for time to call 911, and just plain old time. So if you notice this in yourself or in someone else, these symptoms, you want to note the time that it occurs, because that is important. So if it occurs at 12:30 p.m., you want to make a mental note of that or write it down. 12:30 is when you first notice the symptoms, because that can play a role in the treatment that the emergency team provides to that person or to yourself. And then you also want to call 911. Studies have shown that people that call 911 have better outcomes, because the emergency personnel that arrive on scene, wherever that person is able to start administering medications and diagnosing the strokes much earlier than if you were to drive said person to the ER. Obviously, probably if you're experiencing these symptoms, we definitely don't want you driving yourself. So, but if you were to drive someone else, then that can be not detrimental. We obviously want them to get emergency care, but it can decrease the outcomes, the positive outcomes, because you don't necessarily 100% know they're having a stroke, and you don't have certain medications handy that could help the disability from the stroke from occurring or worsening. So again, that mnemonic is FAST, F-A-S-T, F for facial droop, A for arm weakness, S for speech difficulty, and T for time to call 911. I did put on your little handout there some other symptoms of a stroke are numbness or weakness in the face, arms, or legs, especially on one side. Like I mentioned, it's usually what we call unilateral. That's one side, so either all on the right side or all on the left side. Confusion, difficulty understanding speech, like I said, vision disturbances or one or both eyes, if they're having trouble seeing, if their vision's blurry, or if it goes all black, that can be a symptom of a stroke. Dizziness, trouble walking, loss of balance or coordination, and then a severe headache with no known cause. That can also be a symptom of a stroke. Usually these all come together, so some patients will have a headache, they don't know why it's being caused, or numbness in one hand that they don't know what it is. Doesn't necessarily mean you're having a stroke, but it can be an indicator that there is a stroke occurring if multiple of these are going on. So you want to seek care. Just a few extra things I put on here. I put who's at risk. These are people that smoke, people with AFib or heart arrhythmias, personal or family history of a stroke. That can be a risk factor. Obviously, your older patients or older people, which you're not quite 65 yet, but age 65 or older are more at risk. And then the big ones are the high blood pressure. If you have high blood pressure, high cholesterol levels, which in turn narrows your arteries, or diabetes. The diabetes, high blood pressure, and high cholesterol are the big things that we can change, along with smoking, to lower the risk of a stroke. So important things there. And then lastly, action plan. So we talked about the action plan about what to do if you notice yourself or someone having a stroke. Harvard put out these 6 things that you can do to prevent yourself from having a stroke. So it's keeping your blood pressure low, like we said, so under less than 120/80, exercising at least 150 minutes per week, so that's 5 days a week for 30 minutes is the ultimate goal. Eat a nutritious plant-based diet. Keep your cholesterol within norms, within the normal ranges, through diet, exercise, and then medication if needed. Medication is not bad, but we want you to try your lifestyle changes, and then we can add medication if needed if your cholesterol is high. No more than 2 alcoholic beverages per day, and no smoking or quitting smoking. So those are ways that we can help prevent stroke. I hope this has been informative. If you have any questions, go ahead and let me know.